Thank you for choosing American Pest CEUs. Hi, I'm Sean Reeves. I'm an Associate Certified Entomologist with American Pest CEUs. I've been in the pest management industry since 1999, and I'll be your instructor for today's course. Today's course was compiled by Jack Launius, who has served in the pest management industry since 1990. Today's training is going to be on Core, Chapter 5, Part 1, Pesticide Hazards and First Aid. After studying this chapter, you should be able to differentiate between types of harmful effects, allergic, acute, chronic, and delayed, associated with pesticide application. Also, you should be able to identify common exposure routes for various pesticides and application methods. Pesticides are designed to be toxic to living organisms so they can control pests, e.g., plants, insects, rodents, fungi, and bacteria. At the same time, pesticides must be used with special care to avoid harming non-target organisms, including pesticide applicators, handlers, and anyone else exposed to the product. Very important here on this first slide we're looking at, pesticides are going to be designed to be toxic to living organisms so they can control pests. What is considered a pest is very important. These are going to be plants, insects, rodents, fungi, and bacteria. So when you see this question on any core exam, you need to understand what the 5 things are that can be pests, and this is detailed here for you. Though many pesticides are toxic to humans, they vary significantly in the type and level of hazards they present. In many cases, something that is toxic to one species may also be toxic to other species of organisms. This is especially true if the organisms are closely related. For example, insects, rodents, and humans are all animals that have similarities in their nervous, circulatory, and respiratory systems. Because of these similarities, pesticides can affect people as well as the target pest. Couple quick takeaways that you do want to know on here is the fact that we do have similar circulatory, nervous, and respiratory systems as other rodents and animals. So keep in mind, as a human, you need to think about what type of impacts these pesticides can have on us. Now, this is all part of training you're going to find in the core manual anyways, but you need to understand these things, and we talk a lot about formulations in some of the other chapters. You need to understand how each one of these different formulations and types of products can affect humans and other animals. I want you to keep in mind in these first few slides, I'm laying out an overview of what this course is going to be about. So you're going to see some of the general ideas now, and as we go further in the course, we're going to go more in depth on each of these things. Like when we talk about pesticides can have both short-term and long-term effects on humans. The signal word on the product label and the information contained in the hazards to human and domestic animal section of the label indicate the human toxicity concerns and the precautions you should take to minimize your own risk. So we want to understand, as we learn, we're going to talk more about the short and long-term effects of pesticides on humans, and then the signal word itself is very important, and we're going to talk more about that, but this is going to be in that hazards to humans and domestic animals section of the label. So just pay close attention as we go through these things, because these are going to be very important as you go through your pesticide career. Pesticides can pose additional physical and chemical risk by being explosive and or combustible. If the product presents either a physical or chemical hazard, this information is included in the precautionary statement section. Refer also to the safety data sheets, SDS, for more information on toxicity and precautions. Once again, we're talking about another section on the label. In this case, it's the precautionary statement section. So you should always be reading labels anyways. If you've taken any of our courses and know anything about pesticides, you need to read the label anytime before you use a pesticide. And also you need to understand the different sections. So when we talk about things like the precautionary statements, this is going to let you know if that product presents either a physical or a chemical hazard as we're showing here. You can also refer to the safety data sheets, SDS, because these do have a lot of good information on toxicity and precautions. I would really suggest reading those. You might be interested in what you find and how much more in depth you learn about the products. And especially when you're dealing with clients, they're going to have a lot of questions. The more you understand the label and the more you understand these safety data sheets, the better you're going to be able to serve your clients and ask those tough questions you're definitely going to get out there in the field. Now, if I had to sit and think about what questions I see most on core pesticide exams, I would say toxicity, exposure, and hazard are going to be the three biggest topics. This is the biggest concern with pesticides, as you can imagine. So when we talk about toxicity, exposure, and hazard, toxicity refers to the ability of a pesticide to cause short-term acute or long-term chronic injury. Toxicity, a measure of the pesticide's capacity to cause injury or illness, is a combination of its chemical properties and concentration. Here's another big one. Toxicity is going to refer to the ability of a pesticide to cause short-term, acute, or long-term chronic injury. So remember, short-term injury is going to be acute, long-term injury is going to be chronic. You will see these questions on exams, and I can tell you, you better know the answers to them or you're going to get one or two or maybe even three questions wrong right there. Now, obviously, on exams, you may see things like, what is a measure of the pesticide's capacity to cause injury or illness? Now you understand, that would be toxicity. So when do we need to think the most about the toxicity of pesticides? Or when would we most likely be exposed to them? Examples are going to be handling open containers, mixing and loading concentrates, working around contaminated application equipment, making spray, mist, or dust applications, cleaning up spills, and re-entering a recently treated area before the spray is dried or the dust has settled. Basically, what we're saying here is these are the times when you're most likely to be exposed to a pesticide. Now, those of you that are going to be pesticide handlers, you're completely going to understand this. Anytime you're handling an open container, you're dealing with that mix, that concentrate. It's a lot stronger than a mixed pesticide. So we have to understand when we're opening those containers, a lot of people take knives and cut through a box. But when you do that, if there's a container in there that's plastic, you can cut right through the container. So you have to be really careful handling open containers, cutting into containers. You take those lids off, you've got concentrate, right? So you have to be very careful with that. Now, mixing and loading is another issue. While we're mixing and we're tipping and pouring that container, obviously we can get pesticide concentrate right on us. And of course, while we're mixing with water, they can splash up on you as well. Be very careful about working around contaminated application equipment. A lot of you are going to be doing lawn applications and things like that. You're mixing these 100, 200, 300 gallon tanks and some of the pesticides used through the day. But then at the end of the day, I see a lot of times guys that want to unscrew the lids of the tanks without gloves on and things like that. That would be contaminated application equipment. This is where you can get into trouble and really absorb pesticides when you're not thinking about it. Obviously, when you're making spray, mist, or dust applications, it's a high chance you can be exposed to pesticides. Always make sure you understand the PPE and follow the label in these areas. Cleaning up spills, a lot of times this can be concentrate, obviously mixed pesticide as well. So we've already got a big mess. Wear your PPE, follow all label directions, because cleaning up a spill is another time when you could be exposed. Now, re-entry of a recently treated area before the spray is dried or the dust is settled, this is twofold. This is important for you as an applicator, so you already understand what the label says about this. But if we don't post this for the clients or the customers, nobody's going to know. So they could easily re-enter an area before they're supposed to, just based on the fact that they have no knowledge about the product you've treated with. Think about those of you doing lawn applications. You've got some products that you put out on the lawns, whether it be a herbicide, whether it be a fertilizer. You're not supposed to walk on it for 4 hours, 24 hours. If you don't post that and let the customer know, they're not going to have any idea. So that restricted re-entry interval, as we talk about in core pesticides, is not going to be known to anybody unless you tell them. This is your job as a pesticide applicator. You have to convey this message and make sure they understand exactly when they can go back into an area and when it's safe. Let's talk about the word hazard. Hazard or risk is the true concern for the applicator or handler. It is the potential or probability for harm, injury, illness, or allergy to occur because of the combination of the product's innate toxicity and the level of human exposure. Hazard reflects both the pesticide's toxicity and the likelihood that you will be exposed to the product in a particular situation. Very important, again, understand this word. This will be on core exams. Hazard or risk. So the hazard is the risk. Basically, it's the concern for the applicator. We need to understand the potential probability for harm, which is going to be some type of injury, to occur because of the combination of the product's innate toxicity and the level of human exposure. In other words, a good equation when you're thinking about hazard with pesticides is going to be toxicity times exposure. What is the toxicity of the product and what is the exposure? So obviously, the more toxic a product is and the more or longer exposure you have, the more hazard you have. So just keep that in mind because you will see exam questions that revolve around the word hazard, and it's basically just going to be toxicity times exposure. As an applicator, you can reduce your risk by choosing a less toxic product, by reducing exposure, or both. In situations where a different product cannot be used, you can still reduce the hazard or risk by taking steps to reduce exposure. As a result, pesticide users need to be concerned with the hazards associated with exposure to the chemical and not exclusively with the toxicity of the pesticide. You're going to hear all the time in core trainings, as an applicator, you're making a lot of choices out there. You're making a choice on the products you use a lot of time and where you put them and all of those types of things. So you can reduce your risk by choosing a less toxic product. Now I understand that a lot of you are working for companies, they have procedures and protocols and rotations of products. So obviously you can't always make that choice. But by reducing exposure, when I see that term on here, I think to myself, what can I do to reduce exposure? Mix correctly, make sure I'm wearing the right PPE, make sure I don't spray a product in the wind when it's 30 miles an hour coming in my face. In reality, those are decisions I'm making. I don't need my boss, I don't need another pesticide applicator to make those. I'm the one in charge, I'm the applicator. So you have to make sure that you're making the right decisions based on what you're facing at that moment. At the bottom here, we just made a good point. You need to be concerned with the hazards associated with exposure to the chemical and not exclusively with the toxicity of the pesticide. So if I go into a house that's being fumigated, obviously there's a huge concern and hazard with that pesticide. But if I'm wearing a respirator and I'm following everything on that label, I really shouldn't have a concern. So I'm dealing with a really toxic pesticide, but I'm also following the label and the PPE to make sure I'm not in any harm. So we always have to understand there's going to be times when you're going to use a more toxic pesticide and you're going to have to follow that label to a T to make sure you don't harm yourself or others. The following two examples illustrate that risk takes into account both toxicity and exposure. Gasoline is extremely toxic to humans, especially if swallowed or inhaled. Yet every day, millions of people fill their gas tanks without incident. The toxicity is high, but gas pumps are designed to virtually eliminate human exposure. Therefore, the risk associated with filling a car's gas tank is very low. If someone siphons gas, the risk is much greater because exposure is much more likely. Aspirin has a low toxicity to humans. However, if someone takes too many aspirin at one time, he or she can become very ill. In this case, toxicity is low, but the potential for exposure is high, increasing the overall hazard or risk. Engineering controls, such as gas pumps and child-proof caps, are often designed to reduce exposure. Engineering controls that reduce handler exposure are also available for pesticide mixing and loading. Examples are lock and load devices and water-soluble bags containing formulated product. Those of you that are taking a lot of core pesticide training might understand these water-soluble bags have a powder-type pesticide made to be mixed with water. So that bag just disintegrates and the product mixes in your container. So you don't ever have to handle the actual product because it's protected by that plastic bag that just dissolves in the water. Often, the greatest hazard to the applicator occurs while mixing and loading the pesticide concentrate. There is a significant risk of exposure to a chemical in its most concentrated, toxic form unless engineering controls are used. Hazards associated with the actual application are frequently much lower when diluted pesticides are handled or applied. Some good points were made here, especially that the greatest hazard to the applicator occurs while mixing and loading the pesticide concentrate. That pesticide in its concentrated form is going to be the most toxic. Once we mix it or dilute it with something like water, it's still going to be an issue if we get it on us, but just understand when it's in that concentrated form, that's when it's going to be the most toxic. And obviously, once it's diluted, it's not as toxic. We still need to follow the label and all the safety procedures. I can tell you these are questions you will commonly see on core exams. The hazards may still be substantial, however, in the case of a single high-dose exposure, such as when an accident occurs or when many smaller exposures occur over an extended period. The best way to avoid or reduce the risk of pesticide use is to understand what you are using and how to use it safely in a way that minimizes your exposure. This means reading the label carefully and following instructions. The user's attitude is of utmost importance. If you assume that you know exactly how to use a pesticide without reading the product label, or do not bother to take the precautions indicated on the label, you are more likely to experience excess exposure. Your risk may increase significantly. Pesticide users have a legal and moral obligation to protect their own health and that of others when handling pesticides. Besides protecting yourself, you must be aware of other people, wildlife, or pets that may be in or near the treatment area and could be exposed to the pesticide during or after application. Taking adequate precautions and following good safety practices will reduce the chance of exposure from pesticide application. I know we've talked a little bit about this, but it's very important that you understand. You do have a legal responsibility to make sure that you use these products correctly. Legal and moral, as we talk about here. The last thing I would want to think is I did something that harmed somebody's pet, or something like that. So obviously, we all have an obligation to protect the environment. And when we're treating with pesticides, it's an even bigger obligation because you are going to be using some products that, if not used correctly, can damage the environment around us. So how dangerous can pesticides be? I'm going to give you a little story that happened back in June 28th of 2023 that ended up in the death of a couple pest control workers and 3 others that became ill. June 28, 2023, an autopsy report from Blank County Medical Examiner's Office in the state of Blank found that acute exposure to the fumigant, sulfurilyl fluoride, resulted in the death of 2 pest control workers from the local area. After the fumigation of a warehouse in April, 3 workers fell ill and 2 died after pesticide application. Now you can see here I X'd out some of the information. I'm not trying to put anybody's bad news out there or anything like that, but I did want to show you that if you don't applicate correctly with pesticides and you don't follow these safety procedures, this can even result in death. That's a scary thing. This is a really big deal. A lot of you are not doing fumigations, I understand that, but you have to understand, if this had been done correctly, if they had read the label, if they had worn their PPE, if they had followed procedures, they would have been fine. Because these people didn't, we had 2 people die and 3 more fell ill. What a terrible situation that could have been avoided by just doing the right thing. When we talk about legal responsibility, look at this article I found. The US EPA fines pesticide application company $44,275 for pesticide misuse. Wow, that's a big fine. But this is the reality of what happens out there in the industry. Again, I'm not going to tell you who this was or when this happened, but this is a pretty recent story. The point I'm making here is we do have a major legal responsibility as well. The EPA is watching what we do out there, and if you go out and you don't do things correctly and you do improper applications, you may be the next company that gets on the news where the EPA is fining them. Can you imagine having to pay a fine that big? Not even just that, but this is public information, and what would really concern me with my company is all the bad publicity. If the EPA is fining you like this and news stories are getting out, that hurts your reputation. That's why I'm saying this legal responsibility is a really big deal. If you don't watch it, you could be in trouble fast. The great news is, and we say it in the last line here, taking adequate precautions and following good safety practices is going to reduce the chance of exposure from pesticide application. So there's really no reason why you should have issues as long as you're taking those precautions, as long as you're following the label and understanding what types of products you use, when you use them, and why you're using them. If you do those things, you'll be fine and you'll have a great career in this industry. The great news is, and we say it in the last line here, taking adequate precautions and following good safety practices is going to reduce the chance of exposure from pesticide application. So there's really no reason why you should have issues as long as you're taking those precautions, as long as you're following the label and understanding what types of products you use, when you use them, and why you're using them. If you do those things, you'll be fine and you'll have a great career in this industry. Let's talk about the potential harmful effects of pesticides. Effects from chemicals, including pesticides, may be classified into two broad types: local and systemic. Local effects are those that occur to the area of contact with skin, eyes, or respiratory tract. Local effects are often referred to as contact symptoms or effects. Systemic effects may occur once the substance is absorbed and distributed throughout the body. They may be acute or chronic. Local effects or contact systems are localized to the area that the pesticide actually touches. There's a couple things we want to remember from that last slide. Again, local effects are those that occur due to the contact of the pesticide with skin, eyes, or respiratory tract. So if you see any questions on an exam about local effects, it's definitely going to be when pesticides contact the skin, eyes, or respiratory tract. Whereas systemic effects are the effects on the body after the pesticides have been absorbed into the body. So at this point, the pesticides are inside the body. Now we're going to see the effects they actually have on the body itself internally. So what are some of the effects pesticides can have on the body? Examples are skin irritation, dermatitis, or injury. This could include itching, redness, rashes, blisters, burns, and discoloration. Many herbicides and fungicides cause dermatitis. Fumigants can cause severe blisters, nose, mouth, or throat irritation or injury, swelling, stinging, and burning. Permanent respiratory damage occurs less often. Now again, this is an example of those more local effects. So as you can see, these are more those surface effects to your skin, so they're not internal effects. So just remember, skin irritation, rashes, all these things we're talking about here, that's just going to be those more local effects. This is not going to be systemic. On the other hand, systemic effects may occur once a pesticide has been absorbed and distributed throughout the body. These effects depend on the toxicological profile of the chemical itself, the amount absorbed, and the individual's ability to detoxify and eliminate the chemical. Examples are cholinesterase, inhibition, and neuropathies, damage to nerves, impairment of the blood's clotting ability, and some cancers. And again here we see these systemic effects They occur once a pesticide has been absorbed and distributed throughout the body. So when you absorb that pesticide, it doesn't just stay in a localized area, it gets distributed through the body. As it gets distributed through your body, then your organs are going to break down that product. The effect the product has depends a lot on that toxicological profile of the chemical itself, the amount you absorb, and the individual's ability to detoxify and eliminate the chemical. So this is something that's very important. Obviously, how toxic is the chemical? That's very important. How much did you absorb? Is it something where you got concentrate all over your hands and arms? If you absorbed a lot of it, obviously, that could be a major issue. Also, each individual's metabolism and body is different. Some people are able to detoxify things quicker and eliminate chemicals quicker than others. We all have a different biological system, so you just have to understand that pesticides are not always going to affect two people in the same way. This cholinesterase inhibition and neuropathies, those are very interesting. Cholinesterase has been tied to organophosphates. A lot of people have had that cholinesterase testing, especially if you're working with a lot of organophosphates where that can be an issue. And we'll talk a little bit more about cholinesterase testing here in a moment and exactly what that looks like. Obviously, neuropathies or those damage to nerves can definitely be an issue. I don't see this a lot, but we're just making the point of what pesticides can do if you're not careful with them. Obviously, that impairment of the blood's clotting ability is something we need to think about. If your blood can't clot, that can be a major issue. And also, pesticides have been tied to some cancers. That's a really scary word when we start saying the C word for cancer. It's something we all think about. Keep in mind, the whole points we're making here is we're trying to teach you to follow the label, make sure you applicate correctly to protect yourself and others around you. Now, when it comes to cholinesterase testing, you need to be tested if working with class 1 and class 2 organophosphates, OP, or OP, and N-methyl carbamates for greater than a total of 30 hours in 30 consecutive days. Now, my job today is not to tell you who these people are. It's for you to understand the products you're using, read the labels, and even talk to your employer about what types of products you're using and ask them if this can be an issue for you. One thing you're going to hear about when it comes to cholinesterase inhibiting testing is going to be baseline determination. Obtain baseline measures prior to working with cholinesterase inhibiting pesticides. When obtaining the baseline, ensure that at least the previous 30 days were free of OP exposures. Ensure that cholinesterase inhibiting pesticides had not been handled in the immediate 30 days prior to testing. Establish baselines annually. So you're going to get questions like this on core exams, and it's important for you to know. Obviously, for you to do this baseline testing, you have to ensure that at least the previous 30 days were free of OP exposures. Like we just talked about before, these OP exposures are what's causing this issue. Basically, as we stated here, you just have to make sure that these types of products have not been handled in the immediate 30 days prior to testing. And you're going to want to establish these baselines annually. A lot of you may be doing seasonal treatments, things like that, especially farm workers. So it's always important to think about when you did your last treatment, when the season's coming, and make sure you establish these baselines annually. Cholinesterase inhibition increases the level of acetylcholine in the body by preventing its breakdown, leading to effects like muscle contractions, increased salivation, sweating, and potentially severe symptoms like respiratory distress. And I just wanted to mention this so you understand why this cholinesterase inhibition is a big deal. If this does build up in your body, it can have these effects on your body. So just keep in mind that it is a real thing, and there are some symptoms you definitely would be concerned about if you're having this issue. This slide answers a common question you're going to get on core pesticide exams. A cholinesterase inhibition blood test measures the levels of enzymes in the blood that help the nervous system function. What you need to understand here is the fact that cholinesterase is done by a blood test, not a urine test. I've commonly seen where they'll put a question saying, is it a blood or is it a urine test or something along those lines? It's definitely going to be a blood test, and that's the correct answer. Something else we need to think about is eye irritation or injury. This could be swelling, stinging, and burning. Herbicides, fungicides, insecticides, and fumigants may cause eye irritation or injury. They may also cause reproductive problems, impaired metabolism, the body's ability to use energy, hormonal effects, damage to various organ systems such as the kidneys or liver. So once again, we're talking about some of those local effects, the swelling, stinging, and burning, but we're also talking about a lot of systemic effects here. Reproductive problems, impaired metabolism, hormonal effects, damage to organs, kidneys, or liver. Those are definitely systemic effects that have major impacts on the body. So once again, it's good that you know these, but just keep in mind, always be thinking about local and systemic effects and what the differences in the two are. The U.S. Environmental Protection Agency, EPA, considers local and systemic effects when deciding whether to register a chemical. They are also used to set label restrictions, such as limiting the method, timing, or rate of application, to determine appropriate levels of PPE, or to establish REIs in combination with exposure factor. Allergic effects are harmful effects that occur in some people in reaction to certain substances. An allergy to a chemical contained in a product formulation may cause dermatitis, blisters, hives, or more serious problems such as asthma or life-threatening shock. And when it comes to allergic effects, this is going to be so different for everyone. I know some people, when they work with fungicides, they break out, they get rashes, they have all types of issues. I know people that have worked with things like bifenthrin that have broken out in hives and things like that. So it's really complicated to talk about how an allergy is going to affect one person over another. But just keep in mind, when you're applicating with these products, wear the correct PPE and watch your body and know and understand if a product bothers you, there's probably another formulation you can use. But you have to be the one that monitors that. You can even ask your employer if you need to, can we look at this product? Can we switch the product? I think I'm having a problem with it. Don't sit there and have an issue with a product and think you just have to use it or there's not an alternative, because usually there's an alternative that'll work that you're probably not going to be allergic to. Pesticide allergy symptoms are similar to other allergy symptoms: red and or itchy eyes, respiratory discomfort, and asthma-like effects. Unfortunately, there is no way to predict which people will develop allergies to a particular product. Having an allergic reaction does not predict whether someone would also be more sensitive to other effects of the pesticide, such as chronic or delayed effects. These type of effects depend on different chemical reactions within the body. I want everyone here to understand just one thing. If you get an allergy symptom like red or itchy eyes or have a little bit of respiratory discomfort, this doesn't mean there's going to be long-term systemic or chronic effects within your body. This just means you're having an acute reaction. So don't take it to the extreme, but also understand you need to address these acute effects you're having. I just don't think people should take that to the extreme. Oh my gosh, this is it. I'm going to be really sick for a long time. Typically, once you get yourself out of the exposure area, make sure you get cleaned up. You're going to recover pretty quickly from these acute effects. But keep in mind, everybody's system's different, so there still can be those chronic effects, and you really need to understand your own body and you need to think about what type of effects the pesticide's having on it. I'll close out this little segment by saying I've been using pesticides since 1999. I've never had an allergic reaction, and I definitely haven't had any long-term health issues. So you can applicate safely most of the time. I want all of you to get tested or whatever you think you need to do. I just don't want to scare people and make you think that with pesticides you're going to get sick, or, the old joke, have you ever met an old exterminator? Well, no, of course not, because they die young. That's just not true with the products we have today and with the testing with the EPA. And of course, all of the labeling and all of the PPE we wear. You should really be able to protect yourself quite well. But again, just make sure you understand your own body on this. The next section we're going to talk about is very important. We're going to talk about the routes of pesticide exposure. Now, this is important to your health, as you can imagine, and also those of you taking core exams, you're going to need to know the answers to a lot of these questions. You're definitely going to want to understand that the routes of pesticide exposure include ocular, inhalation, ingestion, and dermal. Exposure occurs when pesticides get onto or into the body through the skin, dermal, the lungs, inhalation, the mouth, oral, or by eye contact, ocular. Product formulations differ greatly in their exposure risk. Some routine pesticide handling procedures present an especially high likelihood of exposure. Ocular exposure can come from things like spraying into the wind, splashes during pesticide mixing, rubbing pesticide into the eye with dirty hands, or even pesticide sweating into the eyes. Always read the pesticide label for proper PPE and first aid measures. Many labels will instruct you to rinse for 15 minutes with clean water as quickly as possible. The eyes contain liquid, so the rinse is merely washing off the pesticide. It serves to replace the liquid in the eye and dilute the pesticide out. Always follow the instructions on the label and seek medical attention when necessary. Eye tissues are extremely absorbent. Blood vessels are very close to the surface of the eye, so pesticides can be quickly and easily absorbed into the bloodstream. Under certain conditions, when using certain pesticides, absorption through the eyes can be particularly hazardous. Eyes are very sensitive to many pesticides. For their size, they are able to absorb surprisingly large amounts of chemical. In addition to systemic concerns, some products are corrosive and can cause severe eye damage or even blindness. Significant eye exposure may result from airborne dust or particles, splashes or spills, broken hoses, spray mist, or from rubbing the eyes with contaminated hands or clothing. Inhalation. Pesticides that are invisible to the naked eye, like fumigants or very fine droplets, are the most at risk for inhalation. What you can't see can be hard to avoid. Pesticide inhalation can cause shortness of breath, dizziness, nausea, unconsciousness, and even death. Follow all label instructions and seek immediate medical attention if inhalation exposure is suspected. Much like flying on an airplane, secure your own PPE before helping someone that has inhalation exposure. Remove them to clean air and seek medical help. If you don't put on proper PPE, things like a respirator, then you too might become unconscious and unable to assist. Always follow all PPE instructions and first aid recommendations on the label. Breathing or inhalation route. Another major concern is the aspiration, suction of petroleum solvents, ingredients in emulsifiable concentrate formulations, and other substances into the lungs while vomiting. As the person vomits, some of the material is aspirated into the lungs, where it can cause severe damage. Breathing or inhalation route. Protecting the lungs is especially important when mixing, loading, or applying pesticides, particularly in confined areas. If inhaled in sufficient amounts, pesticides can cause contact damage to nose, throat, and lung tissue. Once breathed into the lungs, pesticides can enter the bloodstream very rapidly, eventually damaging other body organs, systemic illness. Swallowing or oral route. When people work around pesticides, oral exposure can occur when liquid concentrates splash into their mouth during mixing and loading of pesticides or while cleaning equipment. Never use your mouth to clear a spray line or to begin siphoning a pesticide. Eating, drinking, or smoking without first washing your hands may transfer product to your mouth. Keeping all pesticides in their original containers is not only the law, but it also avoids confusing a drink with pesticide. Ingestion could happen during mixing and loading if a splash were to get into the mouth and be swallowed, but this is unlikely. The most common way pesticide is ingested is by contaminated food or hands. Putting your lunch on a dirty tailgate covered in pesticide is not the best of ideas, so always be sure to clean up all spills and keep food away from pesticides. Pesticide labels also recommend always washing your hands after handling pesticides and before eating, drinking, using the bathroom. So, avoid eating dirty chips by keeping your hands clean and food away from pesticides. Always check the first aid on a label for instructions on whether to induce vomiting or not in case of exposure. This is a big thing we're talking about here. I want to stop for a second. I want you to understand when the label talks about always washing your hands after handling pesticides and before eating, drinking, and using the bathroom, this is a really big problem. Most people that are out applicating with pesticides are going to be eating through the day. They're going to stop at McDonald's, wherever they might, and they're going to go in and they're going to get something. And unfortunately, I've seen this time and time again, people don't wash their hands. If they're eating or they're drinking, you got a big gulp Coke, you have a big gulp Coke in your center console. The problem is once you get pesticides on something, once you get them on your hands, which inadvertently can happen, and you do these things, you're really allowing your body to absorb more of these pesticides. So just keep in mind, it's really important that you wash your hands regularly and especially before eating, drinking, or using the bathroom, because this is one of the easiest way to get pesticides all over your body. Dermal exposure may not cause any immediate symptoms, but can also redden the skin, cause rashes or blisters, and in extreme cases cause permanent scarring. Wearing the proper PPE as directed by the label and making sure you are using techniques that limit possible contact are two of the defenses against this exposure. Washing your hands and skin are a great way to avoid exposure. Soap and water go a long way to limiting possible spread of pesticide exposure. This washing extends to more than just skin. Be sure to wash your PPE as well. Clean, functional PPE can dramatically reduce the risk and severity of exposure. Once again, as we say over and over again, make sure that you're wearing the correct PPE anytime you applicate with pesticides, and washing your hands and skin are a great way to avoid exposure, as we're saying here. Soap and water go a long way to limiting possible spread of Soap and water go a long way to limiting the possible spread of pesticide exposure. Once again, we talked about this before. You need to wash your hands regularly. Make sure this washing also extends to more than just skin. Be sure to wash your PPE as well. I don't think a lot of you think about that. Like, you have PPE, you have gloves, let's say. You're taking them on and off, on and off. At some point, obviously, they need to be changed out. But before that point in time, they need to be washed. That pesticide is going to continuously build up on your PPE. And if you don't wash it according to the label, at some point you're going to contact it. If you're good enough to take your gloves on and off every time without any of the pesticides touching your hands, you're probably better than most professionals out there. So make sure, in addition to washing your hands, you also wash your PPE regularly. Skin or dermal route. In most cases, the skin is the main route of pesticide entry onto or into the body. Some studies show that up to 97% of all body exposure to pesticides during a spraying operation is by skin contact. Dermal absorption or contact injury may occur from airborne dust, splashes, spills, or spray mist when mixing, loading, applying, or disposing of pesticides. Skin exposure may also result from contact with pesticide residues on treated surfaces or contaminated equipment during cleaning, adjustment, or repair. Once a pesticide contacts the body, absorption, penetration, and distribution throughout the body depend on many factors. These include the chemical properties of the pesticide product, the area of contact, and its rate of absorption, and the body's own detoxification and elimination capabilities. Some products that cause systemic injury are just as toxic when absorbed through the skin as they are when swallowed. We're talking about when a pesticide contacts the body, absorption, penetration, and distribution throughout the body, depending on a lot of different factors. We've been talking about this from the beginning. These are going to include those chemical properties of the pesticide, the area of contact on the body itself, and the rate of absorption, which has a lot to do with the area of contact on the body. So we're going to talk more about that as we go. And then obviously, just as we stated before, your body's own detoxification and elimination capabilities are a big part of this. We did introduce an interesting topic here as well. Some products that cause systemic injury are just as toxic when absorbed through the skin as they are when swallowed. That may be shocking to some of you, but some types of products are just as toxic when absorbed through the skin. Keep in mind, these things will be on the label. I'm not going to go into what those products would be at this point. You need to read your label and understand if a product can be just as toxic when it's absorbed through the skin as when they're swallowed. That's a really big deal, and that's something I would want to know if I'm handling a pesticide like that. Parts of the body differ in their ability to absorb pesticides. Warm, moist areas such as the groin, armpits, head, neck, and backs of the hands and tops of feet tend to absorb more than the palms and forearms. However, palms and forearms must still be protected because they get the most exposure. Cuts, abrasions, and skin rashes can increase absorption. Now here's another question I would be shocked if you don't see somewhere on core pesticide exams. What areas of the body tend to absorb pesticides more easily? These are going to be warm, moist areas such as the groin, armpits, head, neck, backs of hands, and tops of feet. They tend to absorb more than the palms or forearms. So keep in mind, when you see this question, you need to answer it. Warm, moist areas, the groin, armpits, head, neck, backs of hands, and tops of feet. That's going to be the answer to the question. However, it's important to note, palms and forearms must still be protected because they are the most likely to get exposure. This is another common question you'll see on core exams. What areas are most likely to get exposed? Again, this is going to be your palms and forearms. Remember, the rate of absorption, i.e. how quickly the pesticide can get into the body, differs depending on the area contacted, but the rate is also a function of time. The longer a pesticide or any chemical remains in contact, the more that will be absorbed. So protecting your skin is still important, even if the area of the body most likely to contact a pesticide has a low absorption rate. Pesticide formulations vary in how well they penetrate skin. In general, water-soluble liquids or powders, wettable powders, dust, and granular pesticides do not easily penetrate skin. However, oil-based liquid formulations, such as emulsifiable concentrates, are readily absorbed. I almost feel like we're getting a small lesson in chemistry here. Now, obviously, if we think about it, water-soluble liquids, they can absorb into your skin. You obviously can understand that. If you go swimming for a long time, you'll see your hands wrinkle up. That's because you are absorbing a lot of water. But we don't really absorb water that easily. If you think about it, if you go wash your hands in the sink, if you don't dry them off, that water stays there. When we look at powders, wettable powders, dust, or even granular insecticides, they're a dry product. They're not wet, so they're even less likely to penetrate and absorb through your skin. However, and this is very important, emulsifiable concentrates are readily absorbed. These are like an oil mixture. Anytime you put any type of oil-based product on your hands or your skin, it's going to absorb. It's going to stay there. This is something for you to remember. This will be on pesticide exams, especially when it talks about how these emulsifiable concentrates are going to be readily absorbed through your skin. This is just simply because they are an oil-based product. Application techniques may also affect exposure levels for applicators. Making overhead applications, using blower, application equipment for mist and dust, using animal porons, and dipping livestock and pets are all application methods that often have high dermal exposure levels. Additionally, contaminated hands or gloves can transfer pesticides to other body parts. Be sure to wash your hands and gloves after each pesticide handling activity. Other people are most likely to accidentally swallow pesticides when chemicals are improperly stored in the home or when transferred into an unlabeled bottle or container normally used for food or beverages. Rodent baits may also pose an accidental exposure hazard if they are not properly placed. Unfortunately, children are the most common victims of these mishaps. Mark all pesticide measuring cups and containers. Store them in a separate area, away from measuring devices used for food and beverages, so they are not used for water, drink, or food. Never store pesticides in beverage or other food containers. Practice good personal hygiene and wear proper protective equipment. Preventing exposure is key to the safe use of pesticides. Product toxicity and health concerns. Historically, the toxicity of pesticides and other substances has been determined by subjecting test animals, usually rats, mice, rabbits, or dogs, to various dosages of the active ingredient and to each of its formulated products. Toxicity, measured for both short-term acute and long-term chronic exposure, is evaluated at a range of doses: those that cause no immediate effects, those that cause some immediate effects, those that cause delayed or long-term effects, and those that cause death. For some of the tests, the doses are administered only once to assess what effects the pesticide may have for a single exposure. Other tests involve dosing the animals over several years to simulate exposure to small amounts throughout a lifetime. These tests can detect many different types of toxic effects, ranging from subtle changes, such as weight loss or gain, which could indicate underlying problems, to specific illnesses, to death. Today, agencies that regulate pesticides, prescription medications, over-the-counter drugs, and many other toxic substances are developing tests that can identify and predict the same toxic endpoints as the earlier tests required. The newer methods use mathematical models and techniques without animal testing. Acute toxicity is the measure of harm, systemic or contact, caused by a single one-time exposure event. Acute effects are determined after test animals have been exposed to a chemical through contact with their skin and eyes, through inhalation, or through ingestion. The harmful effects may be systemic or contact in nature, or a combination of both, depending on the product, formulation, dose, and route of exposure. Acute effects occur shortly after exposure, usually within 24 hours. Here's an exam prep alert. When we speak of acute toxicity, it's very important that you understand this is a measure of harm, systemic or contact, caused by a single one-time exposure event. So remember, acute toxicity, systemic or contact harm, but it's caused by a single one-time exposure event. So this is not multiple exposures, this means a one-time exposure. The following example of acute toxicity illustrates the damaging effects that can occur when people are exposed to a harmful dose of alcohol. Alcohol consumption is fairly common. Each year, relatively few people die from lethal alcohol toxicity due to a single episode. Many people, however, experience varying levels of harmful effects after drinking too much, including headaches, digestive disorders, and disorientation. Symptoms from drinking alcohol depend on the dose, the exposure period, body chemistry, weight, diet and exercise, and other factors. Acute systemic toxicity is the measure of illness or death resulting from a change in critical body function in a test animal. The common method used for comparing acute toxicity is the LD50 or lethal dosage 50%. The LD50 is the dose of a toxicant required to kill 50% of the population of test animals under a standard set of conditions. For comparison purposes, LD50 values of pesticides are recorded in milligrams of toxicant per kilogram of body weight of the test animal, milligram/kilogram. When the animal is exposed to material by feeding, the result is referred to as the oral LD50. When the material is tested by skin exposure, the result is called the dermal LD50. Do not forget this when it comes to LD50. This is going to be the dose of a toxicant required to kill 50% of the population of test animals under a standard set of conditions. This again is a common exam question you would see in core exams. Just remember what that LD50 is. Another commonly used measure of acute toxicity is the LC50 or lethal concentration 50%. This is the concentration of a substance in air or water required to kill 50% of the test population. The LC50 is generally expressed as a ratio of the proportional amount of pesticide to a total volume of air or water. This is usually expressed in parts per million or milligrams per liter, milligrams/liter. The LC50 is a common measure of lethal effects of chemicals on fish and other aquatic organisms. Another important point you want to remember, when it comes to this LC50, you have to know this is the concentration of a substance in air or water required to kill 50% of the test population. So just understand that difference between the LC50 and the LD50. The LC50 values most directly applicable to human health are those expressing lethal concentration of chemicals in air. The LD50 and LC50 values are useful in comparing the systemic toxicity of different active ingredients as well as different formulations of the same active ingredient. The lower the LD50 value of a pesticide, the less it takes to kill 50% of the population of test animals, and the greater the toxicity of the chemical. A couple things you'll see on the right side of the screen here. You see us talking about acute toxicity. Obviously, we know this is injury or illness produced from a single exposure. LD50 and LC50 are common measures of the degree of acute toxicity, but also we're going to be introducing chronic toxicity. This is the ability of small amounts of pesticide from repeated, prolonged exposure to cause injury or illness. Okay, so we have another exam prep alert here. Remember this, chronic toxicity is the ability of small amounts of pesticide from repeated, prolonged exposure to cause injury. This is not a one-time event. This is a repeated, prolonged exposure over and over again that's going to cause this chronic toxicity. LD50 and LC50 values have limitations because they measure only one toxic effect, death. They do not indicate what dose may lead to other, less serious acute systemic effects or to other, possibly equally serious contact or delayed systemic effects. Also, they do not translate directly to humans because our body systems are slightly different from those of test animals. Lastly, the LD50 and LC50 are measures of a single exposure, not the potential sequence of effects resulting from multiple exposures. Some pesticides produce acute toxic effects because of their corrosive or irritant properties. These can result in respiratory, skin, or eye irritation or damage. Some can cause severe burns or permanent blindness. Chemicals with these irritant or corrosive properties require extra care and special PPE. Fungicides, herbicides, and some insecticides may cause contact injuries. Manufacturers list non-lethal, systemic, and contact effects in addition to the signal word. Systemic and contact acute toxicity concerns are indicated by the signal word. They are further explained in the precautionary statements portion of the product label under the hazard to humans and domestic animals sections. EPA and the manufacturer take into account both systemic and contact toxicity measures in assigning the signal word and toxicity category to a product. These are assigned to the basis of the greatest concern, be it oral, dermal, or inhalation, systemic effects, or skin, eye, or respiratory tract contact effects. Summary: pesticide risk can be summarized by the equation hazard or risk equals toxicity times exposure. Toxicity is the capacity of the pesticide to cause either short-term acute or long-term chronic injury or illness. Exposure is the means by which the pesticide gets into or onto the body. These two factors determine the likelihood that harm, i.e. hazard, will come to a person who handles pesticides. Harmful effects of pesticides may occur at the area of local contact or after uptake into the body, i.e. systemic effects. Pesticides can enter the body by any of four routes through the skin dermal, eyes ocular, lungs respiratory, or mouth oral. Congratulations, you have finished Chapter 5 Part 1. Please proceed to the quiz.